Assalamu alaikum. I am Dr. Moniruzamman from Ad-din Medical College, Bashundhara, Keraniganj. Today our foreigners will learn embryology and the development of heart. So this is our topic. And after knowing the embryology and development of the heart, what we know? Further we know the nerve supply, artery supply and venous drainage of heart. After learning this, this chapter will be finished and we will give our item. Everybody understand my words? Yes. This class will continue in Bangla, English and Hindi. Why? Because I have some foreigners from different part of the world. Not only from Bangladesh, a different part of the world. We have Rajasthani, Indians, Somalians and some other country also. So it's okay. Today we are going to discuss about the development of heart. How many heart we have? Please, Suchana. One heart. Okay. One heart in every single and everyone's body, just one heart we have. Very good. How heart develop? Do you know anything about development of heart? No. Please sit down. Do you have any idea about development of heart? How heart develops? Any idea? What do you know about the development of heart? Please. Okay. Tell me. Mesoderm. So we learned something from this girl. She said, sit down please. She said, heart is developed from mesoderm. Speak loud. Heart is developed from mesoderm. Yes. Now what is mesoderm? Any idea? No idea of mesoderm. Now look the image that I draw in the blackboard. This is a mother womb. Everybody know. In there is a uterus. And in the uterus there is a baby. Isn't it? The baby is very small right now. This is the very early stage of the baby. Very early stage the babies look like this. Are you understanding me? Yes. Then it is become so big, something like this. Then it is become more big, something like this, and some hand should become from here, some leg should become from here. So one day the baby become like this. This is the head, this is the leg, and this is the hand. Are you understanding? This is the development of a baby. From the very early one day in the intrauterine life to the 9 month. Now we want to know what is mesoderm. I asked the girl, what is the development of heart? What she said? Only one word, sir, mesoderm. What does it mean? Where the mesoderm comes from? Where is the mesoderm in this developmental process? This is just one word, she said mesoderm. Now we want to know about mesoderm. If any of you, doctor, cut this baby from here, what we can see inside? Any idea? Yes, we have some ideas. Suppose this is a baby from the side in the very early age. I draw this image in a big form. If you cut the baby from here, what you see inside? You will see 3 layers. How many layers?
3 layers.
What are the layers? In the very outside, you will find ectoderm. This is ectoderm. In the middle, you will find mesoderm. And in the very inner portion, you will find what? In the very middle, you will find endoderm. This is endoderm, right? So when this girl said heart is developed from which portion? Mesoderm. Mesoderm. You said mesoderm, right? What mesoderm means? Which portion of the mesoderm? Middle portion of the mesoderm. Middle portion of 3 layers. How actually the mesoderm is in the body of a baby? We need to know these things very clearly. Now draw this image something big, something different way. What is the different way? Suppose this is a baby. This baby in the front view. This is the front view of the baby. Are you understanding? There is a neural tube is going down. Any idea about neural tube? So there is presence of a neural tube. Are you understanding me? Yes. If I cut now here, we will see what color I marked for mesoderm. Ectoderm, endoderm, then ectoderm, mesoderm, then endoderm. Okay. This is the neural tube. Are you understanding? This is the neural tube. This is the mesoderm. I am now focusing only about the mesoderm. This is what? Mesoderm. Mesoderm is covering the neural tube. Which portion of mesoderm has three portions? Do you know that? Mesoderm has how many portions? What are the portions? Any idea? First is called paraxial mesoderm. You heard about paraxial mesoderm? You know about paraxial mesoderm? No. Then there is intermediate mesoderm. This is intermediate mesoderm. This is intermediate mesoderm. Are you understanding? And then there are two lateral plate mesoderm. Which mesoderm this is? So from the very middle, this is mesoderm. In the inner portion between ectoderm and endoderm, this is mesoderm. Mesoderm has three portions. Which portion? First of all, paraxial mesoderm. Then we found intermediate mesoderm. Then we found lateral plate mesoderm. Are you understanding me? So in the lateral plate mesoderm, it will be divided into two portions. Now again, this is paraxial mesoderm covering the neural tube. Do you know about the development of the vertebra? You read about the development of the vertebra. You read about the vertebra, right? This is neural tube. Neural tube is covered by which mesoderm? Paraxial mesoderm. So it is the developmental source of vertebra. Are you understanding me? This is the neural tube. And this is which mesoderm? So it should be the development of the vertebra. Now we are not concerned about the development of vertebra. We are concerned about the development of heart. How heart come? She said it is mesoderm. We found mesoderm has three portions. First is paraxial mesoderm, then intermediate mesoderm, then lateral plate mesoderm. Then lateral plate mesoderm further divided into two wings. One is called splanchnic mesoderm and one is called somatic mesoderm. Somatic plate and it is splanchnic plate. Two plate we have. This is the splanchnic plate and this is the somatic plate. Are you understanding me? You understanding me? Yes. This is which plate? Splanchnic. This is somatic. This splanchnic will come and these two portions will become closer and make the heart. So heart is developed from which portion? Lateral plate mesoderm. In the lateral plate mesoderm, which portion? Splanchnic. Are you understanding me? Now we are going to know how this portion will give development of the heart. How heart is developed from these two portions. This is the concern of our now topic. So in splanchnic mesoderm, splanchnic portion of the mesoderm, there are some this type of cell found. Blood cells are found here and here. Are you understanding? In these two corners, there are some blood cells are found. Then what happened? Suddenly, this is the neural tube. Again the neural tube. Now there is some magic happen. What type of magic? This is which portion of the mesoderm? Paraxial mesoderm. Paraxial mesoderm, this is which portion of the mesoderm? Intermediate mesoderm. Intermediate mesoderm. Now this layer is come like this. This and this. Are you understanding? Which two portion is come too much closer? Splanchnic. Splanchnic mesoderm is coming too much closer. Okay. There was a collection of some blood cells. Okay, these blood cells become too much close right now. Are you understanding? These two blood cells are now coming closer. And making a tube. This is a tube. It is going down. Are you understanding me? This two tube is further. This is the two tube. Now take this two tube and put it here. There is an arterial tube, or there is a blood tube, there is a blood tube. Are you understanding this two tube? When there are some change occur, these two layer become fused. And a structure is something like this. There is something, and from there is something. It become like something like this. Are you understanding? This is now the further thing where from the heart develops. Now I have question to you. Heart is developed from which portion of the mesoderm? Splanchnic. Splanchnic mesoderm. So, if you ever heard about the development of the heart, it is of course from the mesoderm. But which portion of the mesoderm? It is from the lateral plate mesoderm. And the lateral plate mesoderm has two wings. And that two wings, from the frontal wings, it get developed. It is called heart. Thank you very much. This is up to development of the heart. It will further discuss in our next class. Assalamu alaikum.